Hi everybody, this is Matt with Oxford Physical Therapy. I'm a physical therapist and partner in our Northern Kentucky offices. I'm here today to talk about sound-assisted tissue mobilization. And what that is basically where we use these tools to go along injured tissue and we listen for the sound that it might make when we move over scar tissue or fibrotic tissue. These are common findings in injuries such as Achilles tendonitis, lateral epicondylitis, hamstring strains, maybe after surgery if you had a scar. So we use these treatments with lots of different patients. A simple explanation would be as you heal, for example, look at these towels, think of this as the different layers of your tissue. What should happen is if you have a cut or an injury, the tissue should lay down nice and flat and everything's smooth. Oftentimes what happens in scar tissue formation or in chronic tendonitis or irritation where the tissue is pulling and you have inflammation, the tissue doesn't heal nice and flat. It might heal in a rigid or a bumped fashion like that. So you can imagine now the muscle's trying to slide over this area where it's raised. So what we do is come in with the tools and we go through and we move across the tissue and they make a bit of a little sound or a pop that the therapist can feel through the tool, and then we're able to find. This larger tool is what we use as the searching tool. So we might scan the muscle or scan the area, find the pops or cracks, and then we would move in with a smaller tool and treat the area to kind of go back and forth and do some breaking down, and that helps to then flatten this tissue out so that we get that nice normal flat scar that we're looking for, or a flat tendon after an area of injury. So typically these treatments would be done twice a week. This would be in conjunction with some other things in physical therapy like stretching, maybe some electric stimulation, ice, or joint mobilization. Given that this is a kind of an aggressive technique, there is some soreness that's experienced. We are trying to create an irritation, basically. We want the tissue to break down. We want it to flatten out. And so oftentimes there's some soreness, so we do those other things to help calm that down. And these treatments typically would last, for an hour a session along with some other things. And we might do 8 to 10 treatments depending on the kind of problem. In just a few moments, I'll be demonstrating a treatment technique on an actual patient. And what we're going to do is treat Chris's lateral epicondyle here. She's had a bit of tennis elbow. So we're going to use the larger tool to kind of search through the muscle and find maybe some areas of fibrotic tissue or scar tissue. As we do, we can kind of feel some knotting or clicking in there, and Chris can probably feel that too. And once we find those areas where we are experiencing that fibrotic tissue, we kind of use this tool to locate or to start and scan with. And then as we want to get a little bit deeper, we can come in with this smaller tool and do a little bit of working across there, kind of in a cross-friction nature to break that area down. And this area is a common treatment that we use in tendons that are chronically inflamed for tendonitis, like the lateral epicondyle here, or maybe the Achilles or plantar fasciitis. We also use this treatment technique for post-surgical scars and typically after those kind of injuries.